Hi, my name is Shima Shavalu, and I'm going to be treating this patient today who is presenting with lateral epicondylitis. I'm going to be teaching him how to use the modality of placing a cold pack to help him relieve some of the symptoms that he's feeling. So this patient is presenting with lateral epicondylitis, and so he has inflammation at the extensor tendon, and he feels pain specifically when he does activities that require him to extend his wrist as well as activities that require him to grip. So because those two activities are required of him frequently when he's at work, the pain is consistently getting in the way of him. The pain is interfering with his ability to do his job properly. So I'm going to teach him this modality so that he can take an ice pack with him to work and place the ice on at the lateral epicondyle prior to working, and to kind of help decrease the inflammation as well as ease the pain that he's feeling. So there are a few things that I do want to walk you through and ask you to be aware of prior to placing the cold pack. So just a couple of things. Are you aware if you have hypersensitivity or any cold allergies?
No.
Do you have cold urticaria?
No.
Or cryoglobulina?
Not that I know of.
A Raynaud's disease?
Mm-mm.
Okay. Do you know if you have a regenerating peripheral nerve?
No.
Okay. And then, do you have any areas of decreased sensation?
No.
Okay. And then, do you have any areas of compromised circulation?
No.
Okay. So those are things that if at any point you ever do have these things, then you should definitely stop doing this modality. Also, when you are doing the modality, there are things that you need to consistently be aware of. For example, do not leave the ice on your hand for more than 20, or on your arm for longer than 20 minutes. Make sure to consistently be checking your skin. Make sure that you're not having like an abnormal reaction. Make sure to, you don't want to put the ice on like any bony landmarks, because it will be a little bit more painful. And also, you want to never put the ice pack directly on your skin. You always want to put it in like a pillowcase, or you can even use a towel. You kind of want to create a barrier between your skin and the cold pack. Also, like I said, you want to always just be aware of what's going on, because you don't want to ever cause harm to yourself over something, you know what I mean? So the first thing that we're going to do is I'm going to teach you how to do it. Generally, the way we would start it, if you were to come into the clinic, what I would do is I would, I want to make sure that the sensation is on your arm is okay. So I'm going to go ahead and do a quick sensation test. If you could please close your eyes for me. Do you feel this?
Yes.
Do you feel this?
Mm-hmm.
Do you feel this?
Mm-hmm.
Do you feel this?
Yep.
Okay, I'm going to go ahead and test it now. Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. And then you can go ahead and open your eyes now. And then can I have your name for me, please?
Muhammad.
What's your last name?
Haraki.
Okay. And can I please have, where are you right now?
At home.
And what is the year?
2018.
Okay, great. So now that we've gone through just like the preliminary steps prior to doing this modality, I'm going to walk you through the process. Generally, the ice pack is in the freezer, but for the purpose of making things a little bit simpler, I already have taken the ice pack out of the freezer. I have it right here, and I'm going to place it in the pillowcase. Okay, and then I'm going to take this pillow, and I'm going to go ahead and have you place your arm right there. And I'm going to go ahead and place the ice pack as such over here. And then what I also would do is I would tie a Coban strip over it. If you don't have one at home, you can, place your hand over it, but it is easier. You can just go to your local pharmacy and buy one and just kind of tie it around so that the ice pack does stay in place and your arm gets the proper benefits from this modality. Okay, and then also I want you to be aware of what you will be feeling when we put this. You're gonna first be feeling burning, and then aching. It's gonna start with burning, and then aching, and then numbness, and that's completely normal. So it will hurt a little bit, but then eventually you're gonna feel that numbness, and that's the point that we want to get to, because it's gonna allow you to kind of go back to the activities that you want to do, of anything that requires you to grip or extend your wrist. Okay, so go ahead and you would just go ahead and do that. And generally, I like to do a checkup on you at the 8-minute mark. I would just come over and I would check, and I would like for you to do that at home as well. Just check to make sure that everything is going on okay with your skin, that you're not having any adverse reaction or anything to the modality. And then you can just put it back. You can check, at the 5-minute mark, and then at the 10-minute mark, whatever you're comfortable with, but you definitely need to check it frequently. And then that's it. Do you have any questions?
No, I think I'm good.
Okay. So it's really simple. You can buy a cold pack at your local pharmacy, or you can get a bag of ice, or get ice cubes, place them in a Ziploc bag, apply that to your arm as well. Or some people even like to use a bag of frozen vegetables. That will work as well. But just remember, definitely always put it in a pillowcase or something as a barrier between you and your skin, okay?
Cool.
Great. Thank you so much. And if you have any questions, don't ever hesitate to ask. You can always send me an email. I'm always here to help, okay?
Cool. Thank you.